What's happening, everybody? Dr. Michael Sclafani, owner of Tideline Sports Performance and Rehabilitation. And today we're going to be talking about the difference between muscle soreness and pain, what causes them, and what you can do to help manage each of them. So muscle soreness, very natural phenomenon. It occurs both in newer weightlifters and fitness enthusiasts as well as advanced athletes. Nobody's really immune to it. It happens to the best of us. The good news is it's very normal, so there's no need for concern if after a hard workout you still feel a little full in your muscles and you're still having a hard time moving around just because you just feel a little achy and just that dull soreness, muscle fullness feeling. Totally normal. Usually that subsides after 1, 2, maybe 3 days if you had a really hard workout. The reason that muscle soreness occurs, which is sometimes called DOMS or delayed onset muscle soreness, the reason why this occurs is because when you work out, your muscles actually engage in a way that they lengthen under tension. That lengthening under tension creates small micro tears within the muscle cell itself. So what happens is your body needs to repair those micro tears. The way that it does that is it brings fluid, blood, and other cells to the area to help that reparative process. During that reparative process, you start to feel very full still, and that can still make you feel a little achy, kind of like a water balloon that just got a little bit full for just a little bit too long. The good news is, as you continue to move and as you continue to mobilize, all of that will just naturally start to subside. Now, that's a little bit different when we talk about pain. Pain typically is more of a sharp sensation. It lasts for a little bit longer. Sometimes it can result in quote-unquote twinges or different movements that really seem to go from a zero to a sharp pain. Very different here than muscle soreness. Pain can be the result of a few different things. The first thing it can be due to the result of is just a training error. So maybe you moved up in weight too fast. Maybe you're doing too many squats or too many of a particular type of movement pattern and your body's getting overloaded. The other thing that can occur as a result of pain is maybe you're just doing the movement with poor technique. And that could be due to just the fact that you're learning a new movement. Maybe that's due to the fact that you haven't been coached on this movement. Or maybe it's the result of just poor mobility and or poor strength that's resulting in a technique or form breakdown. Either way, if you experience pain, please seek out a healthcare provider. Any of our doctors here at Tideline Sports Performance would be happy to take a look at you and make sure that this isn't something that's going to keep you out of the game for too long. Now, when we talk about managing each of them, we talk about managing muscle soreness. A lot of people like to think about doing things like cold pack versus heat pack, ice baths, cold plunges, cryo, things like that. Right now, there's not a lot of literature or evidence to support one way or the other. However, I can tell you that throughout my 10 years as a sports medicine doctor, that I will say that heat is typically more recommended for muscle soreness. It helps to create more blood flow, which creates more of a cascade of cells that are going to whatever muscle is feeling that soreness to help you recover just a little bit faster. When we talk about something like a cold plunge or a cold pack, that can create a blood flow chokehold and can decrease the much needed blood flow and nutrients to that area to help that reparative process. So again, sometimes we talk about sauna versus cryo versus cold plunge. I'll leave that, guys, up to you, but a lot of times it has to do more with time, finances, and access to those modalities. Now, when we talk about pain, the way that we manage pain is once we are able to work with you here in clinic, we do a deep dive on a full assessment on your movement. Maybe you're having knee pain with squats because you're having limited ankle mobility or limited hip mobility, and those are some things that we can address. Maybe you're having some low back pain during deadlifts because your back isn't strong enough. Those are some things that we can look at and work with you on to make sure that you fully recover and continue to stay active through the game. So, given that this is more of a beginner's program, and a lot of you guys may be entering your fitness journey for the first time, or maybe you're re-entering your fitness journey now after a period of time off, I wanted to be able to differentiate the difference between muscle soreness and pain, and what you can do about it, and when to seek out help from a healthcare provider like us. Hopefully you guys found this beneficial. If you have any questions, comments, or concerns, please don't hesitate to reach out to either myself or any of our Tideline staff.